Hi, everybody. I am Michael Munson, and I am happy that we're all here tonight to do this kind of strange Where's Waldo, who's who of the Medical College of Wisconsin's Inclusion Health Clinic, and who is Forge. We are here with Medical College of Wisconsin staff, so Ann Brooks, Andy Petrol, and possibly joining us a little bit later is Joanna Woodbury. And then Forge staff, we've got me, Michael Munson, Shelley Gregory, Laurie Cook Daniels, and Caleb Weinhardt, who all of us, we might see each other as we move forward today. So we're just going to do some really quick kind of summaries of who each organization is. And I'm going to turn things over right away to Dr. Petrol, who will introduce his wonderful self and the Inclusion Clinic.
Great. Thank you, Michael. So hopefully I'll spend maybe 12 to 15 minutes talking, and then we can take questions either from my fellow panelists or from the audience about what I talked about. So I'm going to talk for a second about things that are happening at Froedtert Health as a whole, and then things that happen at the Inclusion Health Clinic, which is at Froedtert Hospital. So, well, I think I am. Let's see. All right, there we go. So the first thing is I wanted to mention that Froedtert Health went to get leader status from the Healthcare Quality Index starting in 2014. So if people aren't familiar, Healthcare Quality Index is a product of the Human Rights Campaign, the HRC. They first started ranking like for-profit businesses on their practices towards LGBTQ people, and in around 2013 turned their attention towards healthcare. And so Froedtert got and has maintained leader status from HEI since 2014. And so that means that we've had to do a few things. So we need to have in place non-discrimination policies that include LGBT people with regard to patient policies, visitors, and employee policies. This requires a fair bit of ongoing education of hospital staff members. And I thought it's worth mentioning, this is both, yes, to be proud of Froedtert for doing the work behind this and following through on it, but it also says a little bit of something about the state of hospitals in Wisconsin and their, I guess, how much they value LGBTQ health. So there's currently, as of 2018, which is the last year awarded, so as of now, there are 3 Froedtert Health hospitals have leader status with HEI. And there are only a total of 9 hospitals in Wisconsin that have bothered to go through the work that it takes to get this status. So Froedtert makes up a third of all of those 9. But the other issue is that there's 150 hospitals in Wisconsin, and the fact that only 9 have only been able to go forward to get the status is, concerning. So I like to bring it up, even to give kind of peer pressure to other organizations to work towards achieving this, what I would consider relatively basic level procedures in place to get this status. Okay, other things that are happening at Froedtert at a larger level are that we have additional training beyond what's required from HEI for our staff members through the National LGBT Health Education Center, which is a national organization. Sorry, Derek, that was a lot of words right there. We also have put on a transgender health symposium, now in its 7th year, which is kind of a gathering of usually national and local speakers open to our whole campus to increase people's understanding of different aspects of trans health. And we have different types of training that our own diversity office does. For instance, the type of training that you might give to, say, a nurse in a clinic or in the hospital is pretty different than the kinds of things that you might train a security staff member on. And so they've been able to develop training for different types of hospital employees. And Froedtert has a really active LGBTQ business resource group of their own employees. which has been helpful. But to get to the Inclusion Health Clinic itself, I'll talk a little bit about why we opened it and then what we actually do. So the main reason that we opened the clinic is that we thought that this area needed a place for LGBTQ patients to go so that they would have an environment where they felt safe, but also have really excellent healthcare that was tailored to their needs. And our philosophy is that having a specific place where people can go is a need amongst the community, as opposed to having various providers who may be competent at providing LGBTQ health, but not co-located and not really working together. So we thought having a group working together in a place that's well known is something that would be of value for the community. We also think that it's important that the Medical College of Wisconsin, which is one of only 2 medical colleges in Wisconsin, have an opportunity for its students and residents to become better and gain clinical experience with LGBTQ health. So that is something we're now able to offer to our learners through the residency programs and also to our medical students to spend time in our clinic seeing patients and learning from patients and from their providers. We also like to use the clinic, as I did kind of a moment ago, and leverage its presence to raise awareness of the importance of LGBTQ health amongst other providers in our system. And that's resulted in a lot of positive changes that we've seen, both in interest in other specialties joining our practice, our clinic, as well as just generally a greater demand for additional learning about LGBTQ health. So I'll just briefly review what we have available. So you can see a picture of 6 of the 8 of us now. I didn't have pictures for the last 2 who joined, but so what we like to do, comprehensive care, so that includes general primary care, gender-affirming hormone therapy, OBGYN care, HIV treatment, and HIV prevention. And amongst our group, we have some specialists who, as you can see on the right there, are specialized in some of these fields as well. So we have an endocrinologist and a psychiatrist in our group. We recently had the addition of 2 gastroenterologists to our group, whose pictures I don't have. Referrals to gastroenterology were one of our more common referrals, and that specialty approached us and asked if they could have a couple of their faculty members join us. And so they are joining us soon. We can accept basically any kind of insurance, including Medicare and Medicaid. We will take care of anybody starting at age 15 because we're technically an adult hospital. So the definition of what an adult is variable, but we've set it at age 15. So I just wanted to go over some of the things that we did to try to make the experience better for our patients. Oftentimes, and I guess unfortunately, visits still start preemptively with a health information form that people get in the mail before they come to clinic. So we did some edits to that. We asked people their legal name, but also what name they use for themselves. We asked about gender identity and sex at birth on the form. So people who want to disclose that information can come with the form filled out that way. We try to have visual cues to make sure people know that this is a safe place to be. This poster goes up during Pride Month, but often stays past that because it makes people feel good. We have added some artwork in the clinic, which I hope speaks to our patient population. We have non-gendered restrooms. We have staff that have been trained specifically on taking care of trans patients. We had Ryan Salins, who I believe is a future guest on this webinar, who came actually twice to train different parts of our staff on being trans, competent, inclusive, and welcoming. I mentioned our providers that you saw pictures of before, and I wanted to talk a little bit about what the electronic medical record can do for us now. So, wow, there's kind of a duplication of slides when you go this way. All right, I'm going to skip through some slides so we get to the slide I was talking about. So we asked questions on the paper form that I showed a little while ago, but now the medical record actually has a way of capturing some of that information. So you'll see that a lot of the things like pronouns and gender identity can be entered into EPIC and then can be displayed for any member of the healthcare team to see. I think one of the more important parts is the organ inventory. So this is a nice place where we can keep track of what organs a patient has. This is, of course, most important for cancer screening, but it can also come up in other contexts. Okay, so I thought I'd just take a second to emphasize some things that a patient may encounter at our clinic. The things in the left column are things that are often done at most medical visits. So of course we do those, but we also spend additional time on the things in the right-hand column, which we think are pertinent to our patient population. So talking about any desire for fertility, we discuss prior hormone and silicone or other injectable use, and we talk a lot of, we want to understand what surgeries a person may have had before, and as I mentioned just a minute ago, we want to understand what organs or tissues a patient has so that we can best help take care of them. Some other kind of philosophical points is that we aim to use a patient's terminology for their body parts. So whatever word a patient may use to refer to a body part, we just adapt and use that word for the rest of that visit and future visits. I think it's important that we only do physical exams when they're necessary and that a patient understands why we think they're necessary and they actually agree to do it. I usually don't do a physical exam on the first visit because I feel like it's important to just let people get to know us, and then if something is necessary, we'll maybe defer that to the second visit. As I mentioned earlier, we do have learners, but it's always up to our patients to decide if they want to participate in education of our learners. So we ask patients ahead of time before we would come in if they are willing to see a learner, and if they're not, then the visit goes on without the learner. And then finally, in this area, we feel it's important to get feedback from patients, both positive and hopefully constructive, or sometimes negative. But we want to know how things are going for our patients. So every new patient gets a letter with the name, phone number, and email of the medical director, which is me, because we want to get direct feedback from our patients so we can continuously improve the experience. So besides what happens in the clinic, which is what I spent about the last 10 minutes talking about, there are other services that are sometimes useful to our patients that are available at Froedtert. And these include things like voice therapy, laser hair removal and makeup training, injection of facial fillers, face and neck surgeries, chest surgeries are available, and then hysterectomy and orchiectomy. So I will stop there. This is information on how to find our clinic, and I will let's see if people have any questions. I'll actually ask Anne if I missed anything that you wanted to add to this description.
I think that's it.
Okay. All right. Great. Michael, when I'm sharing, I can't see the questions that are typed. So if there are some, please let me know.
I do not see any yet, and I did not do my job at the beginning of letting folks know that they can ask questions in the chat box, or they can raise their virtual hand. Usually those controls are along the bottom of the screen. So if folks do have questions, that is the place, those are the two places to do so. And we can just pause for a second to see if there's any question. And while we're waiting for a second, could you tell us if the Inclusion Clinic is still accepting new patients right now?
Certainly. So we absolutely are accepting new patients. We have had pretty strong demand since we opened, and so our wait time was not what we really want, but we are remedying that very soon. We have a new provider who is joining us who will just about double our capacity for new primary care patients. So Kevin Robertson will be joining our clinic starting in August, and we'll be able to actually start taking appointments for his schedule in the next few weeks. So, you know, we'll be taking appointments about 2 months out for him, but that'll actually get us caught up. So hopefully our wait time is more like a couple weeks instead of a couple months. But we're always glad to take patients, and you know, if there is some type of an urgent issue, we always try to handle that even ahead of like the first visit. This often comes up if people have like moved here and they need help with something like prescriptions or something else. If we have a future appointment in place, we're able to usually help out with an urgent concern.
That's really good to hear. And I know that a lot of times we hear folks looking for psychiatry care, and I think that was one of the folks that were on your list. So of that list, are folks able to see mental health care providers that are able to prescribe?
So what we've had to do, I guess, unfortunately, you know, there's a shortage of a lot of types of providers, including people who are competent and experienced with LGBTQ health, but there's even a greater shortage of mental health providers. So because we work as a team, we wanted to ensure that we, the kind of primary care and other providers, would be able to send people to our psychiatrists whenever we needed our patients to be seen there. So we've had to close the psychiatrist practice to people who aren't seen in our clinic otherwise, because it wasn't going to work out for us to be able to work very well as a team. But certainly anyone who has seen any other of our providers is able to see our psychiatrist in the clinic.
That's good to hear. Good, thanks. Are there, I'm not seeing any questions in the chat box. Do you have other things that you'd like to add now before we kind of turn the slide deck over?
I think I included most of the things that I wanted to talk about. I guess I just want to reiterate that this clinic is really a product of several years of passion and toil to get it going, and that we really want the community to feel at home in the clinic, and we really want feedback on anything that people want to tell us. We love positive feedback, but we know that we grow from hearing other types of feedback. So I do want people to feel like this is a community resource, and that we are all available and want to hear back from people. If there's things that we're not currently doing that we could be doing that would be helpful to people, or if there's ways of improving the experience that our patients have.
That is good to know as well. Excellent. Should I share my slide and share my screen and flip it around?
I will.
Excellent, thank you.
Okay. And then you may share.
Let's see if we can do this. All right. So are folks able to see the slide?
Yes.
Excellent. Thank you. I never know what's going to happen sometimes, and Zoom keeps on changing their controls and their magical things. So so thank you, Dr. Petro, for sharing about the Inclusion Health Clinic, and we are obviously very happy to be partnered with you in this project and in sharing our collective resources. So I was hoping that tonight we could share just a little bit about Forge's history and what our current work is. So I'll be sharing some things. Laurie Cook-Daniels will share a little bit about our mission and core beliefs, and then Shelley will talk some about the advocacy roles that they play a primary part of. So I also mentioned Caleb, who is also on the call on the back end today. So this photo was taken at Pride last year when Pride was still happening, and it was nice and sunny, and we were all enjoying the great festival that Pride Fest is. So a little bit about Forge. We've been around for 26 years, so quite a long time that we've been in existence. We have kind of a dual role that we work both here in Wisconsin as well as nationally. So the national work that we do is predominantly around training and technical assistance of victim service providers. And the local work that we do is kind of a blend of general trans work as well as supporting survivors of sexual assault, domestic violence, and other forms of victimization. We have about a ratio of around 25% of our time is spent doing that direct service and working within trans and non-binary communities, and around 75% of our time is spent doing training and technical assistance with providers. So Laurie, could you share with us the mission and core beliefs?
Yes, I think I will be on video, and I think I'm on voice. Michael, you hear me? Okay.
Yes, good.
So Forge's mission is to create a world where all voices, people, and bodies are valued, respected, honored, and celebrated, where every individual feels safe, supported, respected, and empowered. Our work focuses around the following 4 central beliefs. 1, a belief that trans people and loved ones are resilient, but may still benefit from some reminders and skills. 2, a belief that service providers have the profession-specific skills they need to serve trans people, but simply need additional trans-specific knowledge and confidence. 3, a belief that every person is valuable and has a great deal to contribute to society. And 4, a belief that binary systems and thinking create arbitrary lines between people and communities, which damage spirits and resilience.
Thank you, Laurie, for sharing those with us. So those are some of our guiding principles or our core beliefs that really guide the work that we do, both within trans communities and with the providers that we work with. I wanted to share with folks because I think a lot of times people have interactions with Forge and they only kind of know what they know at the point in time that they enter the services that we offer. So just a little bit of history of where we came from and where we are right now. So like I mentioned, we're 26 years old. So we started in 1994. And from 1994 through 2003, we were really very focused on F to M, so female to male, and that was the language of that period in time. So F to M focused, and we mostly worked with folks in terms of support groups and connecting folks to providers. So in 1994, there were a lot less resources or a lot less known resources, and people didn't have an active internet to go to find what they needed or wanted. From the very beginning, we had a really strong focus on the inclusiveness of what it meant to be transmasculine or transmale, which included, non-binary folks and a really wide realm of folks, as well as significant others, friends, family, and allies. who benefited from those services. In the year 2000, we merged with the Transgender Aging Network, which was a program that Laurie started in, I believe, 1998, and it became a program of Forge. In 2003, we broadened our scope from transmasculine kind of only focus to serving folks of all genders. Obviously, people were welcome before that, but we made a very conscious choice to expand to serving all gender vectors in 2003. That in part was because a lot of the programs locally here in Milwaukee and even some in Chicago were not supporting trans women as well as they were hoping to be served. So we tried to pick up some of that slack and offer some additional services to a wider range of people. In 2003, 2004, we also started the shift towards working with anti-violence issues. So we launched a national survey, we moved from local to national work, and we started a lot of survivor-based support in Wisconsin that then grew to a national base as well. In 2007, we held the first Midwest F2M conference, so female to male conference. I don't think there's ever been another transmasculine conference here in the Midwest since then, and a lot of the conferences across the country now have kind of become more homogenous for trans folks. So that was 2007. And then in 2009 was when we really began getting traction with funding and being able to have paid staff. And that was also the time that we really devoted a lot more of our energy to anti-violence work, as well as doing training and technical assistance with victim service providers and allied professionals. So those allied professionals are therapists, physicians, law enforcement, lots of the people that work with trans folks who have been victims. So just to give you a little bit idea about what we do nationally, so you've heard me say training and technical assistance many times now. For training, we do a lot of on-site training before COVID-19, when we were able to travel and do that work. We do a lot of workshops at conferences, again, when we were able to travel, and a lot of webinars as well. For technical assistance, what that generally means is one-on-one support. So an agency or an individual at an agency will reach out to us by phone or email or on social media, and they will come with a challenge or a problem that they would like some support with. We've done a lot of site visits as well. So we've gone to people's sites and helped them revise their policies, their procedures, how they're working with clients to be better informed about how to work with trans clients. We also sit on a wide variety of advisory boards and think tanks to try to contribute to the overall well-being of trans survivors and trans people in general through multidisciplinary means. Additionally, we produce a fair number of publications, not as many in the last few years, but that should be changing also in the next year or so. We do things that are really short, like fact sheets, or longer publications. We participate in doing like info briefs or white papers. A little bit else about what we do nationally. So this is for trans survivors of violence. We have a blog at trans.survivors. Actually, it's trans/survivors.com. And it is still in its infancy. It's a couple years old, but it's still slowly growing. We do a lot of direct advocacy and referrals for survivors all across the country. We create publications as well for trans survivors, trans community members. And we work a lot with service providers in other areas to make sure that trans folks and non-binary folks are supported in their survivorship wherever they are in the country. So a little bit else about what we do nationally. The work that we do nationally can oftentimes support both providers and survivors. So some of that is really around policy change and reform. So we really focus a lot on aging and anti-violence and health-related issues. We also care about kind of broad, wide-ranging trans policies. So things like conversion therapy or, are trans folks in the Affordable Care Act, a lot of those things that are affecting trans folks all across the country. And we do that in partnership with many absolutely wonderful folks that are also engaged in this work. So just to give you a little bit of a snapshot for the scope of that work, so if we look at just what happened last year, so in terms of training, we trained 1,857 victim service providers or allied professionals. We provided technical assistance to over 4,000 individuals who requested services. We held 16 webinars or virtual trainings last year. And we served a total of 561 trans survivors who received direct support or advocacy from us in 2019. So I'm going to turn things over to Shelley right now, who will talk about our local services and support that we offer.
Great. Thank you, Michael. I'm going to assume that everyone can see and hear me until someone tells me otherwise. So, as Michael just said, Forge has work that we do both nationally and work that we do primarily locally in the state and region that we're located. Forge is headquartered in Milwaukee, Wisconsin. And we work throughout the state and sometimes a little bit more broadly throughout the region on issues that are important to trans folks. We do the work that we do here in the state in a couple of different ways. Like our national work, one of the things we do is support other service providers in Southeast Wisconsin and throughout the state. And there are different ways that we do that. Forge has an extensive history of offering trainings for service providers, and as you heard Laurie talk about our missions and our belief statements, we believe that professional service providers know how to do their jobs, know how to provide the services that they are providing, but that they often need some assistance to learn more about and to gain some additional knowledge about how to work with trans individuals and have the confidence to do that well as well. So in Wisconsin, we offer customized trainings as well for various different kinds of professionals. In particular, we offer a fair number of trainings for medical and mental health providers. We have folks on staff. I am an attorney. We have begun to work with legal providers throughout the state, nonprofit legal service providers, as well as folks who provide services in private practice to help them understand what kind of services trans individuals in the state need and how to best provide those services. And of course, we work with victim service providers similarly to help them increase their competency as they work with survivors of violence and various crimes so that they can work with trans folks more competently. We also additionally offer consultation and the kind of technical assistance that Michael talked about in state, and that can often include site visits on site where we'll have staff come in, talk and work with the staff of the service provider to really get at what kind of assistance that provider may need to help increase the effectiveness of their service to trans folks. We additionally have our staff speak and present at various conferences and to various groups around the state and around southeastern Wisconsin, and we're always available to do that. A nice thing that we're able to do for the service providers that we work with and for those that we work with one-on-one and those that we meet through trainings is that we are often able to introduce service providers to each other and make referrals for service providers to help them expand the world of professionals that they're connected to who are able to provide trans knowledgeable services services to their own clients. The other kinds of services we have for providers, again, similar to what Michael talked about, we have an extensive online library of publications, training videos, training webinars, fact sheets, all available for self-study and for providers to take a look at to do some learning on their own. The other work that we do in Wisconsin focuses primarily on supporting trans individuals directly. We do that through group services and through individual services. Forge, for a very long time, has held regular meetings. They have varied in their content over time as we adjust to the needs of the community. But we offer meetings that offer a number of different have a number of different aspects to them for folks. So we have meetings where we offer sometimes what folks are looking for and need is a place to just hang out and develop social connections with other folks in the community, and our meetings are a place, at minimum for folks to do that. Our staff is there, and folks are able to receive support from our staff and from other community members, and we often will incorporate some skills building or information or education into these meetings as well. And so these meetings can vary greatly in their content. We have done things like viewed films and had a discussion afterwards. We sometimes do education about knowing what our legal rights are in various contexts, like employment or housing. The other primary group service that Forge offers is that we have a wonderful facilitated support group for our parents of trans youth. So parents, guardians, other adults who have trans youth that they're responsible for and care for are able to get together on a regular basis with one of our very skilled staff members, Laurie, to talk about raising their trans kids and support each other and to get support from Laurie and from each other to help better support their kids with everything that they're dealing with. So the other type of services that we provide directly to the community in Wisconsin are services that are provided directly to individuals, to trans individuals. So folks can be in touch with us in many, many different ways that Michael will review before we close today. But folks can get in touch with us, reach out for a whole range of resources and support. I am one of the primary providers of support services and connections to resource in Wisconsin, but our entire staff has been doing this work for a very long time. We're pretty well connected with providers across the state of Wisconsin who are serving trans individuals, and we get a lot of feedback from folks that we work with about their experiences with various service providers. And so, we are able to sit and talk with folks about, what it is that they need or that they're looking for, be it a doctor to or a medical provider to help begin hormone therapy, be it a discussion about whether a particular gender-affirming surgery is something that will be feasible for them to do in the next year, or it could be things like everyday things like where can I get a haircut in Milwaukee from somebody who is going to be willing to cut my hair the way that I want them to, and they're going to be happy to be serving me and celebrating who I am. Where can I go to be comfortable trouble in finding clothes. You know, I want to start dressing. Where can I get clothes? Where can I go shopping? Where could I get a bra fitted where I'll feel comfortable? These are, you know, all kinds of resources that we can help connect folks to in Wisconsin. So, you know, we've put some information on the screen here about some of the specific things that we do. Referrals to trans-knowledgeable medical and mental health providers and others. Advice about changing identity documents. You know, folks are often, you know, sometimes intimidated by the idea of changing their name or their gender marker on their identity documents. These are things that we've helped people do innumerable times. We can give you advice about that. We can give you some guidance. If you need help doing that, I can often be available, you know, literally to go into an office or to walk down to the courthouse with somebody to help file these papers, if that's the kind of support that somebody would like to get these things done. The other thing that we can help with sometimes is dealing with health insurance companies, and in particular dealing with denials of prior authorizations. So, you know, we certainly know that insurance companies can often end up being the deciding factor about whether somebody is going to be able to access the kind of medical services and care that they need. And when we get all of our ducks in a row and we've done everything that we need to do, sometimes, you know, getting that denial from the insurance company feels really devastating. You know, it's important for people to know that there are processes and there are routes to appeal these decisions from insurance companies, and that's the kind of advocacy that we can offer. So, you know, we can not only offer advice about how to work with insurance companies, but, you know, I can get on the phone with you and talk to your insurance company and help get you through an appeal process to see if you can get, you know, authorization for the medical services that you'd like to have. You know, another major issue we deal with and help folks deal with is knowing what our legal rights are, and knowing how to assert our rights if we're facing what feels like discrimination in various contexts. You know, often discrimination at work, in housing, or in school settings for students, whether they are, you know, junior high, high school students, or whether we're talking about colleges and universities. We can offer, again, some advice and some guidance about how to deal with these things, and we can offer referrals to competent attorneys to help with them. One of the biggest things that I do is provide what we call peer support and counseling. So I said I'm an attorney. I am trained as a lawyer, but I have a lot of experience and training providing support to folks via peer counseling. And, you know, what that means is that you always have a place that you can call. There is always a listening ear on the end of the phone when you call Forge. And, you know, I have spent countless hours, you know, just talking to folks, listening, hearing about challenges folks are having, and providing some support in the way that I'm able to do that. And, you know, what I hear over and over and over, and all of our staff hears, is how nice it is to just be able to talk to somebody, how refreshing it is to talk to somebody, you know, that we don't have to explain ourselves to. So we are always here and we are always available, regardless of what the issue is, what the challenge is, or what kind of support you're looking for. And if we can't help you, we will make every effort to get you to somebody else who can help you. We talked about our supports for parents of gender expansive children. That primarily includes our parent support group. We're also available to provide one-on-one support to parents who may be helping their children with any of these issues. A couple of the other things we do is related to the victim services work, the anti-violence work that Michael mentioned earlier. We we have funding, and we are trained as sexual assault advocates, which is a particular, that has particular meaning in the legal world. So we are folks who are able to be available to support individuals who may have experienced sexual or other violence. Folks can always reach out to us for support with those experiences. And what we can do, you know, number one is listen, offer supports, and if folks are interested, we can talk about what resources are available and what options that folks have when they have had these experiences. And, you know, sometimes that includes making a report to police. It may include needing to seek medical care or examinations, or it may not. That really depends on what individuals want to do. But we are trained advocates, we're here and we're available. And that support that we offer includes physical accompaniment. We are allowed under the law to be present in hospitals, to be present at police stations, to be present with folks in interviews if they need to be interviewed by the police. So we are always here to provide those supports as well. Some other supports we provide around through our anti-violence work is doing work around safety planning, and that can mean lots of things. That can mean, you know, just talking on the phone about some ways to think about, you know, if we feel that we're facing some risk of violence, to think ahead about some plans that we can put in place to help increase our safety. If folks need help seeking legal interventions and restraining orders, we can do those things as well. And as Michael said, and I mentioned earlier, we have a large library online, not only for service providers, but also for community members themselves, with lots of educational and know your rights materials. And with that, I think I'm turning things back over to Michael.
Thanks, Shelley. It's hard to sometimes be the sharer of the screen and click all the right buttons. So thank you for sharing all about our Wisconsin-based resources. I wanted to share one more slide about what's going on in Wisconsin, which is stuff that most of you already are knowing about because you're on this call. And that is the program that we are doing together with the Medical College of Wisconsin's Inclusion Health Clinic. So it's PACT NOW, which I can never remember what all of the acronym stands for, but it's a series of really rich and in-depth programming that we're doing. So 2 ask sessions each week, so on Tuesdays and Saturdays, 3 connect events each week, so that's Wednesday, Thursday, and Friday, and then a learn, which is some documents, some videos that we've done a couple of fact sheets already, and more will be coming out in the next couple of months. And support is really tied into being able to ask for support or care around either COVID-19 or around anything trans-related that we can try to help you with, or we will refer out to a trans knowledgeable source if we don't have the answer. So like we did with national things, I just wanted to very briefly show some snapshots from 2019 about the scope of the Wisconsin work that we've done and that we are doing. So in 2019, we served an unduplicated amount of people, which was 200 unduplicated individuals that we served in 2019. So those are trans individuals or loved ones who needed or wanted direct care. In 2019, we also conducted a needs assessment survey, and we had 523 respondents in Wisconsin. So Caleb is working on and has finished most of our reporting of that, so that should be coming out really soon, the results of that. A little bit delayed in that response coming out. And in 2019, we also enhanced our database of service providers who are working and are respectfully working with trans clients. So we've got 36 more primary care providers, so either physicians or nurse practitioners that we've expanded our database to, and 73 additional mental health providers. So it's really beautiful to see that growth of the options that people have for the services that they want and need. Shelley mentioned that I would share with you our contact information. So the ways that you can reach us are through our website. So we have 3 primary websites. One is our national website, which is really mostly focused on victim service providers. The other that is probably most useful for folks on this call is the Wisconsin website, so forge-wi.org. And then the Trans Survivors blog, which is trans-survivors.com. So those are the 3 websites that you might want to check out. We have many different ways that you can connect with us on social media. These are just the pages that we have, and doesn't include the groups. We have some private Facebook groups that are more specific to specific populations, but Facebook for national and Wisconsin, and then Twitter and Instagram, which are pretty much nationally scoped and a catch-all. And then our YouTube channel, where you'll see promotional videos like for these kinds of programming, as well as the recordings of the Ask sessions and many other different recordings that will help both victim service providers and are hopefully useful for trans community members as well. You can connect with us by email. So the PACT NOW email address will come to me, and I will forward it on to the folks that might be able to answer your question best. I've also put in Shelley's email address because Shelley is the person that is likely going to respond to folks if they have Wisconsin-based questions. And our phone number is listed as well, and it's a textable number as well as a voice number. So those are the ways that you can reach us. So I would love to open it up for time for questions about Forge, or questions about the medical college if you have things that have been brewing in your head about either of our organizations or our services. So again, you can share your questions through the chat feature or through raising your hand if you'd like to raise your hand. So there are 2 questions. One is, can you provide assistance in case of being arrested at protests? So Shelley, can you come back on video and address that question?
Sure, thanks. Thanks for that question, Heather. So Forge does not provide direct legal services, but I will be more than happy to take calls from folks to talk about what your options are if you are, for instance, arrested at a protest. And what we can do then is get you referred to a criminal defense attorney if that's necessary, or get you to the right sources of information to help with that.
And we are certainly partnering in these interesting days of protests and a lot of the things that are going on right now. We're doing a lot of partnered work with Zao Milwaukee Church, who are also well connected with other folks who are doing some of that direct action work and are probably in a really good place to help out with what happens if people get arrested. A second question is, if somebody needs to get their signature notarized, can we help with that, or where could somebody get help with that? Shelley, I would like to have you answer that as well, please.
Sure. Yeah. So I am very soon we would have the capacity to help with notary services. We don't have that capacity at the moment. In the meantime, there are lots of places that notaries are, often at banks. You don't even need to be a customer of the bank. You can just go in and tell them you need someone to notarize a document for you. I'm not sure if post offices still offer they probably don't. I guess I would probably recommend a bank or a place like a copy shop, like a FedEx place where they do shipping. Those places may have notary services. And if you need help finding notary services, just shoot me a message and I can help find some place near you.
And to respond a little bit more to that question, Shelley's very skilled at helping folks know what they need to bring with them so that that notary process will go smoothly. I'm looking to see if there are any additional questions that folks might have. And I'm not seeing anything coming up. I know that it's a nice rainy night out tonight, and I'm glad that folks are here with us instead of getting wet. I will make sure that if folks would like our contact information again, or the Inclusion Clinic's contact information, perhaps we could type that into the chat box so folks can have that to go home with. And when we have this as a recorded video, we will make sure that all of that contact information is listed below in the YouTube channel as well. So I'm not seeing any other questions. So I wanted to thank our interpreter, who is always fantastic. And I misgendered because I thought Derek was Jill, because Jill's usually our interpreter. So thank you for rolling with the misgendering. And thank you everybody for being here tonight. We've got a really great week of events coming up. So tomorrow night we're having kind of like a poetry slam, but it's a speak out, so activism and heart slam. So we encourage folks to bring your favorite authors, especially if they're political, or especially if they're people of color, or especially if they're trans, and share either their words or your words. Thursday night, we're going to have a chat-based discussion about safety planning. So both for if we are protesting, if we're concerned about COVID, or if we're living in home environments that may be a little bit less safe. So a whole bunch of safety planning things that we can talk about on Thursday. Friday, we are going to have another meditation and grounding session. Last week, Friday, it was a really beautiful and calming session. So Matthew Lewis will lead us through that on Friday. And then Shelley on Saturday is going to talk about those of us who would like to have a name or gender change in Wisconsin, how to go about doing that, and all of the nitty gritty of those things. So that is this week, and folks can stay tuned for what's coming up next week that we'll post a little bit later in the week. So thanks everybody for being here. Thank you, Derek, for interpreting, and have a good rest of your evening.